The Hamas-Israel war that began on October 7th has become a source of international tension, debate, and dispute. And much of this centers on fatality counts, the numbers of people killed in battle. And this, of course, rests on the accuracy of the toll reported by the Hamas-run Gaza Health Ministry. While, of course, accurate death tolls are not possible in any war, but that hasn't stopped journalists, politicians, and sometimes even area experts from citing statistics as though they were ironclad. I'm Rob Satloff, the Segal Executive Director of the Washington Institute, and I'm here with Gabriel Epstein, a researcher at the Institute who has dug deep into the data released by Hamas's own Ministry of Health and has found a much more complex picture. Gabe, what are the key takeaways that you found from your research?
So the first thing I noticed was just the number of differences between this war and previous wars. The first major difference is simply the scope and scale and the stakes. This is a war that's an order of magnitude larger in terms of destruction, but it's also an order of magnitude larger in terms of the stakes. Hamas is facing destruction as an organization. Israel is facing an existential threat to its security. Those things alone mean that we can't treat this, any aspect of it, as we have previous wars, and that extends to the death toll. The second thing that I found is that most of the procedures that have been followed in previous wars either disappeared or deviated. The UN, and run by the Office of the Coordination of Humanitarian Affairs, and local NGOs, which used to monitor over the shoulder of the health ministry for the death count in hospitals, morgues, etc., haven't done so this time. So that removed an external check, a third-party validation. And another big difference is that part of the way through the war, about a month in, the health ministry bifurcated its methodology. They went from one methodology to two. The first methodology is the hospital and morgue system. That's what we understand. It's been used for the past 15 years, and it's generally regarded by the international community as reasonably accurate. Not perfect, but reasonably accurate. But the second methodology they introduced, they've only named as media reports or media sources. And then in April 2024, the health ministry released the results of a third methodology, which was self-reports by relatives of those killed. At the same time, it started to call media reports just incomplete reports after coming under scrutiny from several news outlets.
So you're saying that somewhere during this conflict, so November, I believe, the way the health ministry counted fatalities changed?
Absolutely, yes. So Hamas on November 10th formally said, due to the collapse of hospital and medical infrastructure in the northern two governorates, that's Gaza City and northern Gaza, we can no longer report fatality figures from those areas. It wasn't until a month after that, on December 11th, that they finally disclosed, and only in an Arabic report on their Telegram channel, that they had added this additional media reports methodology. The fact that they kept releasing results throughout the month of November indicated that there was still some counting going on. That's actually been a common misconception for a lot of people during this war, is that either the health ministry is operating perfectly and as it has before, or that it has totally collapsed. And the truth is really somewhere in the middle. As conditions changed, they adapted by adding a new and opaque methodology that we don't understand, while still maintaining the old one that we understand better where they could.
So again, just for our viewers so they can understand, beginning of November, up until then, the first 3 or so weeks of the war, reasonably accurate counting is what you're suggesting. But then a totally new methodology based on press reports. Don't know exactly which journalists, which press outlets, which platforms, but press reports were the source of the health ministry's fatality counts. Is that correct?
Yes, there's a real shift. Media reports are not by themselves an incorrect way to estimate casualties. It's done in many places, Sudan, Ethiopia, where it's an extraordinarily large battle space, there's huge access problems, etc. But they're usually done facing backwards in time, and it takes months to reconstruct even one event. So the idea that media reports, which again, like you say, haven't been defined, can in real time be some sort of accurate metric, it's very doubtful.
So when we look at the actual data from these two sources over the last 4 or so months, what do you see?
So I looked into that. I started by comparing the data, and the way you do this is actually interesting because it relies on two data streams. The first is a series of health sector emergency reports that the Ministry of Health published, and the second is what the Government Media Office releases maybe once or twice a week, which has figures for the total number of women and children killed. When you look at the Central Collection System numbers over the last 4.5 months, 52% of those reported killed are men and about 15% are children. But when you look at the media reports figures, what you see is the exact, even more extreme opposite. Only 8.5% of those reported killed via the media reports methodology are men, and 63% are reported to be children. Now, for reference, the Gaza Strip's population pyramid is extremely flat. About half the population is under 18, and about a quarter each are adult men and women.
All right, so again, to translate this into more simple terms, the hospitals are reporting that a significant majority of those killed are men, whereas the media reports are reporting that a very large majority are children or women. And this cannot, both of these facts cannot both be true.
Yes. Yeah, there's no way to reconcile gaps of this magnitude. And it's also important to say upfront that the majority of men in Gaza are civilians, right? They're not Hamas fighters, they're not Palestinian Islamic Jihad fighters, they're not affiliated with any of the armed groups. And why it's so critical to remember this is that civilian men are casualties of war too. The fact that Hamas or the UN or any other body chooses to highlight women and children doesn't change the fact that there are many innocent men who die in every war. They matter equally to the women and children. They matter equally. It doesn't matter Israeli, Palestinian, anyone. So it's very important that they be counted accurately and that their loss also be understood.
If these numbers cannot be reconciled, if one source gives a majority of men and another source gives a majority of women and children, what is happening? Is this purposeful? Would you call this manipulating the data?
It's a good question whether or not there's active data manipulation going on. Many people have alleged that, other people have defended the credibility of the health ministry. I think in the end, the picture is very complex because what we think of as manipulation is not necessarily someone sitting somewhere with a spreadsheet and changing legitimate numbers that were given to them. Sometimes it can look like something that I think we at a baseline understand is possible and likely happening. If a Hamas fighter or a Palestinian Islamic Jihad fighter is killed in a tunnel, if they're killed well behind enemy lines because they pop up out of a tunnel and try to attack the IDF, or simply if they're killed and no one around is willing to take a video of it or report it to somebody because they're worried that if they report that a lot of Hamas fighters were killed somewhere, Hamas might come after their family for revealing their losses, militants are not going to show up in any of the systems the Ministry of Health is using. And for that reason, there might be a real underrepresentation of men in the media reports system. Now, that said, the underrepresentation is far too drastic for it to just be about what's happening with militants. And because we don't know anything about media reports, it could be social media, it could be journalists, it could be pulled out of thin air. There might be a database, there might be no database. We have no idea. And that's part of the problem here is that there's no clarity and that no one has really looked into this and pushed for clarity on this point.
Is there any way to use these numbers with confidence and say that these numbers that come from the Gaza Ministry of Health represent the fatalities on the Palestinian side in this war?
I don't think there's even a way to use them as a rough guide anymore. And you certainly, if you can't trust the total, you can't trust the breakdown into men, women, and children. So what can we do with the numbers? Well, you can look at trends. So there's been a really marked decrease in the intensity of fighting and the number of people killed. And that matches with what we observe in terms of the IDF's battle plan, etc. Switching from a full-blown ground invasion with many divisions inside the strip into only having a couple and decreasing the size of their operations.
How does this experience of trying to track wartime fatalities while the battle is going on, how does this compare with other examples of this effort? Say, for example, the U.S. effort to track fatalities in Iraq or in Afghanistan?
It's a great question. Comparing this war to other wars is really important. What I think it reveals is exactly how hard this is and why it would be surprising if there was real accuracy in these numbers. The US war in Iraq, which began in 2003, the death toll is still totally uncertain. The range from the Iraq Body Count Project is somewhere around 40,000. That's between their low estimate and their high estimate. If we go further afield to conflicts that had less media penetration, less attention, or where the combatants worked harder to conceal the deaths of civilians or others, let's say Ethiopia or Sudan, our envelope of uncertainty is in the tens or hundreds of thousands. And that's very common across wars, even in the 21st century.
So what should we do? What do serious observers who want to look at fatality numbers as an indicator of the brutality of war going on in Gaza? What should we do?
There's only so much you can do during the war. The situation is very chaotic. You're not going to repair the health ministry's ability to count via the hospitals and morgues in central and northern Gaza anytime soon. You're not going to get any sort of credible independent estimates anytime soon. There are NGOs like Air Wars, which are working back. They're still, I think, in October or November on individual airstrikes, individual incidents, and they have a very robust methodology using social media and interviews, etc., to try and estimate the number of casualties. But those efforts face backwards. It will take years to deal with this. And so the question is, what do we do now? What do we do right now? And it would be good for journalists, for analysts, for governments to take their same understanding that they don't know the real death toll in Ethiopia or Sudan. They know it's a very wide range, and apply that to a situation like Gaza. Despite all the media attention and all the videos and images flowing out, that's not a substitute for a robust casualty counting and verification system. And the system that was once in place in Gaza has been largely degraded and replaced by much less accurate or transparent methods, let's say.
Gabe, thank you very much for helping to explain the real numbers behind Gaza fatality counts.
Thanks very much, Rob.